Hi, I'm Dr. Liz. How are you? Can you see and hear me okay?
I can.
Awesome. And just to confirm, you're in a safe and private location.
I am. I'm in my house in a safe room.
Good, good. So we're going to be doing this visit via telemedicine. Are you familiar with telemedicine?
I am. Since the pandemic, a lot of my work has turned virtual. I've done several appointments virtually as well.
Good. And so are you okay to consent to medicine visit today?
I am.
So I see you have some concerns with the new skin lesion. Can you tell me a little bit more about that?
Yeah, I noticed something on my left arm. I have moles, and so I go in maybe once a year when I have time. I just haven't had a lot of time lately. And so with work and everything, I haven't been able to get in. But I did notice something on my arm that was kind of irritating. It looked like a mole, and I was scratching it, and it's getting a little bit irritated and was changing and getting a little bigger and different colors too. So I was hoping somebody could take a look at that.
Yep, those are all great things to notice and things that we get concerned about. Can you tell me how much sun exposure you've had growing up?
Well, I grew up in the 80s and 90s. And so we used to go on a lot of family vacations to Florida, and we just didn't, do a lot of sunscreen. And so I did get several burns when I was a kid. And then, lately I've been working outside. I've been doing a lot of landscaping as the spring is here, and I try to use sunscreen, but it's so expensive. And so when I can, I try to cover up, but I haven't been doing a great job of being able to be out of the sun lately.
Yeah, it is hard, and sunscreen has been very expensive. So happy to recommend a few options that are more affordable, as well as some protective clothing options. But before we talk about that, any family history of skin cancer?
I do. My uncle on my dad's side did die from melanoma. And my dad also has had some kind of lesions removed or things on his skin removed that aren't cancer, but maybe kind of before cancer. And so I think that's why I had been pretty careful about going in every year. But like I said, I've just been really busy, so haven't had a chance to make it in this last year.
And any other social determinants that have prevented you from coming to visit us? Any issues with transportation, childcare?
Childcare is definitely an issue. I have two little kids. I'm a single parent. And so I don't often have times during the day when I can come in. And when I do have times, I'm going to have to bring them with me. And it being like a full dermatologic, body exam, it's always made me kind of uncomfortable to do that with my kids. And so I think both of those things have been tough. So appreciate you asking. Notice how the provider is capturing details about the patient's job and daily life that may be important factors in adherence. The patient has concerns about affording sunscreen. This may be an opportunity for social work services to look at a health plan coverage or at discounts in the community. Also, we are introducing the family history for this visit. This is something easily attainable during a telemedicine exam and is an important part of any visit when assessing risk for cancer.
So let's move on to the physical exam. I know you have a peripheral device that you can use to help let me see your skin. So if you can use the device, and I'll take a look at the area today.
Perfect. Yeah, thank you. I do. I have this device. I'm going to go ahead and punch on the skin exam there. And it's having me take a picture. So I'll go ahead and do that now. And I'll tell you when it's being uploaded to you. Okay, the image was captured. And so it looks like it's being submitted to you. So you should be able to take a closer look.
Okay, let me see. Okay, I have it here. Thank you. I'm going to look at the lesion. Let me take a minute.
Again, notice the introduction of a peripheral device to give the provider a clear picture of the skin lesion. Much of the physical exam during the telemedical visit can be augmented with the use of peripheral devices.
So I'm looking at the lesion, and I'm not too concerned for skin cancer, but given your exposure, I would like you to come in and see us, for a thorough physical exam at your convenience. I know you said that you're working during the day, so let me connect with our after hours clinic, and they might have an opening that can assist you with transportation if you need that as well. And let me know if you need any help with childcare during your visit, and we can arrange for that support as well.
That would be wonderful. I have the transportation, but I definitely would need help with some after hours options. And if there are some childcare options available, that would be great. That way I don't have to bring my kids in to a visit where they're doing an exam like that. So that would be great. Any options on sunscreen? I know you had said that there might be, I don't know if there was somebody in your office or some type of coupon cards or something that you knew of that could help with that cost.
Yes, when you come visit, we have a whole list of great sunscreens that are at a reduced cost, as well as some samples and some coupons. And we have a whole list of brands so you can shop around, but we make a nice list of ones that are affordable.
Oh, wonderful. Thank you so much. I really appreciate your time. Notice how the provider addresses various social determinants of health within the completion of the visit. The provider wants to ensure the patient can come in for care and is hoping to remove some of those barriers. Try to think about this when talking to patients. Use telemedicine to see into their homes and explore some of those barriers to engagement and see what solutions you can come up with.
Absolutely. Glad we can make it work. If you're done, I'll have you hang up first on your end, and we'll see you in clinic.
All right. Thanks so much.
Thank you.